Hi guys, hope you're all doing great. Today I would like to discuss about different types of headaches. I hope this video will be helpful for all those who are preparing for their NEET PG, PLAB, USMLE or AMC. We could start with a tension headache. A 29-year-old IT professional, after coming home from his job, feels a bilateral constant headache, complains of a pain around his head for a time period of 30 minutes. And he feels much better after taking a cup of coffee. In such cases, you can suspect a tension headache because tension headache is always a bilateral constant headache that persists for a time period of 15 minutes to even hours. And people feels better by taking NSAIDs or caffeine. There are cases where this headache persists for more than 15 days a month. In such cases, you can give prophylactic treatment with tablet amitriptyline. That's the first type. The second type is a migraine headache. Migraine is a very common type of headache. People present with a sudden headache and they also say a previous episode of similar episodic headaches. They also complains with a prodrome of symptoms including yawning, photophobia, phonophobia, and this nauseating episodes and all. Usually, migraine is considered as a cortical spreading depression or a trigeminal nerve pathology, which is usually a treatable condition because people sometimes complains of having aura during their headache episode. Suppose a 20-year-old female presents to your casualty with an episode of a migraine headache. You should ask them about the history of taking OCPs. OCPs are oral contraceptive pills because if a person is a woman who is taking OCP is at a higher risk of having a CVA or a stroke if he or she is suffering from migraine. So we should stop OCPs in women having migraines. As the abortive treatment for migraine, we mainly gives triptans. Triptans includes the most common triptan we know as sumatriptan. But these triptans are contraindicated in patients having peripheral vascular disease, CVA, or other CVS associated pathologies. These triptans act by inhibiting trigeminal nerve activity. But these triptans, if used more than 10 days, can lead to overuse headaches. These triptans can also cause serotonin syndromes. But there is a tablet or a medicine called lasmiditan. It is actually it is also a triptan, but it is an exception that acts by serotonin IF receptor agonist pathway. It is not associated with vasoconstriction action. So it is comparatively having lesser number of side effects. This patient who is complaining of migraine will also be having complaints of nausea or vomiting, dizziness, scintillating scotomas, or tinnitus. So, the treatment of migraine also includes high-dose NSAIDs, IV or IM chlorpromazine, or we can even treat them with dopamine antagonists. There are preventive treatment available for migraine. If a patient is complaining of 3 episodes per month, you can treat them by giving anticonvulsants that includes topiramates or valproates. And you can also give them like this propranolol or venlafaxine or amitriptyline. All these things are very useful in case of preventing episodes of migraines. For women who are having their who are crossing their pregnancy period and they are having a history of migraine, it will be better to use acetaminophen or other NSAIDs, and triptan is considered as a last choice. So that's about migraine. So the third type of headache is a cluster headache. Cluster headache is usually a unilateral headache present with a pain behind the eyes. Patient also complains of lacrimation, rhinorrhea, but there won't be an aura. It's usually a circadian type of headache, and the most important treatment is just oxygen. It's said like 100% oxygen is very useful for treatment of this cluster headache. There are other types of headaches also. Another one thing is paroxysmal headache that is actually mainly seen in females at the age of 40 to 55 age group. It lasts for almost a 15 minutes period and it is having a very good response to indomethacin. There are other types includes like this medication overuse headaches. There are people who take paracetamol or panadol on and off in between for headaches. In such people, the simple remedy is to stop their NSAIDs usage. Another one type of headache is a low pressure headache. It is associated with this postural headache. People once they are in a supine position, when they comes to the standing position, suddenly they suffer from this type of low pressure headaches. In such cases, you can treat them with NSAIDs or epidural blood patches. Then once a person is having continuous headaches, we should do a further investigation to rule out any other causes associated with this headache. So that's about headache and different types of headache. I hope this video was useful. Thank you.